Now I'd like to move on to the next session, which is about identifying the traits or characteristics of ASD and ADHD in prison and developing rehabilitation during sentences. We have two presenters from Finland, Sanna Kara and Katri Mikkola. Sanna Kara is an occupational therapist and currently studying psychotherapy at the University of Tampere. She has worked over 15 years with clients who have neuropsychiatric traits. And Kara has led different kinds of developmental projects related to rehabilitation, supported employment and social services. Katri Mikkola is a clinical psychologist and a PhD student at the University of Helsinki. And she has worked with neuropsychiatric and neurological and psychiatric clients. And in addition to the project work, she's currently also practicing clinical work and doing research about ADHD and ASD traits among Finnish offenders. Ladies, the floor is yours.
Thank you.
Thank you. Greetings from Finland.
Hello to everyone, and thank you for this opportunity to give this presentation and tell about our project, which is ongoing in Finland. My name is Sanna Kara.
I'm Katri Mikkola.
And in this presentation, we will tell you about one part of our project, which is identifying traits of ASD and ADHD in prison population in Finland, and the rehabilitation model which we have developed. Then a couple of words about the content of our presentation. At first, we will say a couple of words about Autism Foundation Finland, and after that, we will give a brief overview of the project. Then we will tell you a little bit about the characteristics of ASD and ADHD and how the traits might be related to criminal behavior. After that, we will focus on presenting you more about the work that we have done related to identifying neurospectrum traits among Finnish prisoners and developing rehabilitation for this target group. In this presentation, we use the term neurospectrum, which refers to ADHD and autism spectrum disorder. Here is our team, and in addition to us, Minna Tuusa works in our project team. She is a Bachelor of Social Science, and so we are kind of multi-professional team. Autism Foundation Finland was established 1998 by families whose vision was to help deliver independent and meaningful living for people in the autism spectrum. Currently, we operate in 18 locations throughout Finland, and we have 350 professionals working for us. We offer a comprehensive selection of services for daily activities, vocational activities, and supported living. In addition to that, we have different kind of developmental projects ongoing. Then a little overview of the project before we go more details on the topic of this presentation. The primary target group in our project is prisoners and offenders who have traits of ASD and ADHD, and the secondary target group is Criminal Sanctions Agency, healthcare services for prisoners, and Police of Finland. We have cooperated with 6 prisons and 2 community sanctions offices. We are very grateful for good cooperation with Criminal Sanctions Agency and healthcare services for prisoners during this project. Without this, we couldn't have succeeded. We have 3 main goals in our project. The project has 3 The first goal of the project is to ensure that legal rights of the person with neurospectrum traits are met during the detention and pretrial investigation. We have organized training sessions and developed support material for police officers, criminal investigators, advocates, prosecutors, and judges on how to recognize and interact with people who have neurospectrum traits. The Police University College and University of Eastern Finland use these materials for educational purposes. Over 250 professionals have participated in training sessions and cooperation with the project related to this first goal. The second goal is related to that in prisons, the staff could better recognize prisoners with neurospectrum traits and learn how to interact with these prisoners. And the third one is to develop a rehabilitation model and organize support for them during the release. And now next, we'll tell you more about the actions related to these two goals. And now Katri continues.
Thank you. First, I'm going to tell you a little bit about neurospectrum. As Sanna said, here we refer to it as autism spectrum and ADHD. As neurospectrum is an informal term, it's not a medical term, but we use it as the target group themselves like to use it, and they have it's okay by them. So autism spectrum and ADHD are neurodevelopmental neuropsychiatric disorders, which means that they start in childhood and they affect the person's life throughout the lifetime. And they have a neurobiological basis, so it's connected to how the brain works. Here are the characteristics of ASD. There's two main categories of symptoms or traits. The first one is deficits in social communication and social interaction. And for example, there's this deficits in nonverbal communicative behaviors used for social interaction, such as the eye gaze or facial expressions can be somewhat abnormal, and in many cases, people with autism can be seen somewhat weird. There's also the second main category, which is restrictive and repetitive patterns of behavior. And there is, for example, the second part is insistence on sameness, inflexible adherence to routines, which can be seen in the prison ward as a problem. And also another example is this highly restricted fixated interests that are abnormal in intensity or focus, such as trains or UFOs. And also it is good to notice that girls with autism can have more kind of normal interests, can be like Barbies or makeup, but they're abnormal in intensity in many cases. And these interests can be associated with the criminal behavior, and they can be connected to the motive of the crime, which is why this is important to notice when working with offenders with ASD. Here is shortly about ASD and offending. It is not an independent risk factor for offending, though the comorbid psychiatric disorders and late diagnosis increases the criminal risk for the criminal behavior, probably because they don't get the sufficient rehabilitation or other help for their problems. And as I said, the ASD traits might be associated with the criminal behavior, and this is why it should be noted and should be the focus of the rehabilitation also in prisons and such. Here is the list of the most common types types of offending when dealing with offenders with ASD. Here's violent behavior, sexual offending, fire setting, obsessive harassment or stalking, and cyber crimes. And then a little bit about ADHD. There is two main categories of traits or symptoms. There is inattention, where a person might be forgetful, easily distracted, can make careless mistakes, and can have trouble organizing tasks and activities. And the other category is hyperactivity and impulsivity. The person might fidget, tap hands or feet, talk excessively, interrupt others, and many adolescents and adults with ADHD report inner restlessness. And these can also cause institutional behavioral disturbances in the wards. And there are 3 different presentations, which are seen here, combined predominantly inattentive and predominantly hyperactive impulsive presentation. And the prevalence of ADHD among adults in population is 3 to 5%, but the prevalence among young prisoners is about 10-fold, which is why it is important to note in this target group. The ADHD in itself is an independent risk factor for offending and recidivism. And prisoners who have ADHD have a higher number of incarcerations and early onset of criminal activity. And also it is important to note that young offenders with ADHD may be at greater risk of acting out on the impulse to self-harm and or to act violently towards others. And here are also a list of the most common types of offending among offenders with ADHD. There is theft, assault, and drug and weapon related crimes. And these crimes can be made like really impulsively, and they are in many cases not planned ahead. So yeah. And next, I'm telling you a little bit about what we have done to help and reach our goals related to this identifying neurospectrum traits among Finnish prisoners and offenders. We have trained the staff of prisons and community sanctions office and also prison healthcare staff. We have had these training sessions where over 1,000 staff members have participated. The training focuses on how to identify these prisoners, how to interact with them in good cooperation, how to recognize possible challenges that they might have related to these traits, and how to best support these prisoners with their challenges. We want to emphasize that the staff is not supposed to make a diagnostic examination. They just have to, we want to help them to recognize the behavior and the possible needs behind it, and help them to understand why prisoners act this way. And we have also made different kind of support material for them, for the staff. Then we have this, we had developed this screening tool for recognizing neurospectrum traits among Finnish prisoners. It is also used in community sanctions offices with their clients. The rating of the screening tool is based on staff observation, so it's not self-report tool or assessment tool. and it is not to be used as diagnostic screening tool. And it is important also to notice that many other psychological and psychiatric issues might cause the observable symptoms. For example, anxiety can cause psychomotor agitation and difficulties in concentrating, and borderline personality disorder can include also, it includes also impulsive and risky behavior, similar to ADHD. So the aim is to recognize the prisoners' different needs related to possible neurospectrum traits and not to categorize them. It is also included in the next National Comprehensive Prisoners' Health Study in Finland, and I'm doing my postgraduate dissertation concerning ADHD and ASD traits among Finnish prisoners, and also validation of the screening tool. About 500 prisoners will participate in the study from different prisons, and there is both women and men and women prisoners participating. And the data collection includes different self-rating questionnaires, semi-structured diagnostic interviews, and neuropsychological tests. And the data collection starts at the beginning of the next year. Here you can see the screening tool, though it's in Finnish and so small you cannot read it. But there is 10 items, 5 are related to ADHD and 5 are related to ASD. And the rating goes, the description doesn't fit the person fit at all. The description fits somewhat, the description fits well. And there's also this difficult to assess, not enough information for assessment. And here you can see the items, the 10 items, 5 of ADHD and 5 of ASD. And I think you will get these slides, so I'm not gonna go these all, I'm not gonna read these aloud for you. You can read them yourself from the slides. We have one short case example for you from the juvenile ward. I will read this to you out loud. A staff member from the juvenile ward contacted the project team as they had had problems with one of their inmates. The inmate was causing disturbance, provoked other inmates, and was lacking motivation concerning the rehabilitative work and his own future. The staff member had filled a screening tool based on her observations on the inmate's behavior. The score of the screening tool was 11 points, as all the descriptions associated with ADHD fit well with the inmate's behavior. He had problems with paying attention, was distractible, acted impulsively, and was unable to control his behavior. He was also very hyperactive. He talked excessively and interrupted others, was walking around the ward and cell, and was fidgeting a lot when needed to sit down. His belongings were around the ward, and he was unable to organize his appointments and matters with social agency. He was also somewhat oversensitive to loud noises, which made it even more difficult for him to pay attention. So next, Sanna will tell you a little bit about the neuropsychiatric rehabilitation model that we have developed.
Okay. In the development work, we have used international classification of functioning core sets for adult ADHD and ASD, especially related to skills training areas. The exercises that we use during the rehabilitation are mainly based on ACT and DPT. There is research related to ACT and DPT, and the evidence suggests positive outcomes using these methods with forensic patients, prisoners, and persons with ASD and ADHD. Our model has a kind of transdiagnostic approach, which means that we don't focus on diagnosis. For example, emotion regulation difficulties are related to different kinds of psychiatric disorders, but they are also related to ADHD and ASD. So these methods works for different kinds of clients. Working with people who have neurospectrum traits, it's also important that professionals have knowledge about neuropsychiatric disorders and how they affect clients' behavior. About 80 to 90 prisoners have participated in this rehabilitation during this project. Here you can see the skills training areas in our model. As I say, the main two areas that we work with our clients are emotion regulation and impulse control. Problems with these areas also often are the risk factors for criminal behavior and substance abuse. Arousal management difficulties are closely related to impulsivity and emotion regulation. Prisoners with ASD typically have difficulties in social cognition and social interaction, and working with them, this might be the key area in addition to emotion regulation. Prison environment is supported for prisoners who have executive function difficulties, but there is also people in this target group who have severe problems in this area and need everyday support in prison. Then a couple of details about emotion regulation. In many cases, prisoners have difficulties recognize emotions, and anger is the primary feeling that they report. If you think about anger, it's very intensive emotion and also risk for problem behavior. During the rehabilitation, through different exercises, we practice emotion awareness, labeling different feelings and how negative thoughts are associated with anger, and there might be some other feeling behind anger. We also practice noticing impulses and making mindful value-based choices. Sometimes the emotion is so intensive that we have to practice coping skills, where the goal is to down-regulate the emotion, and after that the person is capable to make mindful choices. Here you can see the rehabilitation process from assessment and goal setting to skills training and termination of the rehabilitation process. It's very important that the client is motivated and that the goals of the rehabilitation are client's own. This kind of skills training requires intensive and long-lasting work with the clients to make the change possible. It's also important that client practices these new skills between the sessions. In conclusion, some outcomes and feedback related to rehabilitation from participated prisoners and prison staff point of view. Prisoners have felt that they have learned new skills, especially mindfulness skills, emotion regulation skills, impulse management, and they have also found that they have got new perspectives in place of criminal thinking. In turn, the prison staff have noticed that participated prisoners have engaged better in other prison activities, and they have took more responsibility on their own rehabilitation process. From prison staff point of view, the prisoners have gained new skills and more self-knowledge. Also, the prisoners who had institutional behavioral disturbances before rehabilitation had these less during and after rehabilitation. Our project is near its end, but we got new funding from Ministry of Justice, so we will continue the rehabilitation work in prisons, and during the next 2 years we will also develop online rehabilitation model for this target group. So I think our time is end, so Thank you for your interest towards our presentation, and if you have any questions, we will be happy to answer.
Thank you.
Thank you.
Okay. Thank you, ladies. Very, very interesting. I have one question.
Yeah.
From a probation officer, which is I like very much, of course. It says, should we pay more attention to the psychological aspects of client rehabilitation than to the formal aspect of technical issues? Is it clear for you?
Sorry. No.
Shall I repeat it?
Yeah, thank you. Thank you.
Yeah, okay. Should we pay more attention to the psychological aspects of client rehabilitation than to the formal aspects of technical issues, let's say, of rehabilitation? We pay a lot of attention on rules, on regulations.
Yes.
Yeah.
Definitely should be more pay attention about psychological issues.
Because
Okay.
they are the underlying problems there in many cases.
Okay. I can see that people are very interested in the screening list.
Yeah.
So thank you. I have some questions myself. Could you say that there's an overrepresentative group of ASD and ADHD in prison population?
ADHD, definitely. ASD, it's not so clear, and we need more research on that.
Yeah.
Yeah.
It's more or less the same question from my colleague Kirsten Havlicek. She says, do you have an idea of the percentage of prisoners that face such problems? And what about the number of juveniles compared to adults? And she asks for women too, of course. Yeah.
Yeah. Well, concerning ADHD, juveniles, there was this one big meta-analysis where it was 30% from juvenile prisoners of offenders had ADHD, and it was 26% among adults, I think.
Yes.
In Finland, we don't yet have this data, but I hope that we will. After my study, my research, we have more information concerning that. And about ASD also, because, well, it's a bit more difficult to assess than ADHD.
I can imagine. More questions or comments are coming in. To end this presentation, I will read some to you. They're very flattering, I think. So it's a thank you for your presentation. Can I ask whether the program can be applied to juveniles as well? That's from David Frott, one of the panelists. I think you already answered that question.
Yes.
Yeah. And then from Donatella Caponetti, she said, a very interesting study and project. Clearly, diagnosis must be very accurate, as some of these traits are common to most deviant people, and the risk is to stigmatize them with a wrong classification.
Yeah, that's really important.
Yeah. And there's another one I said, that's from a nice colleague from Finland. He said the screening tool is excellent. We have been using it in RISE as well, the probation offices as well.
Yes.
Okay, ladies.
Thank you.
Thank you very much. You already said that you will send your presentation to us so that we can upload it on the website. Oh, we got one more question coming in. Well, that's then the last one.
Yeah.
Does this is from Deborah. She says, does the justice system in your country adopt a different approach with persons with autism? What kind of help is given?
Does it mean that do they get this different kind of if they are? I'm not sure.
Well, the question is, does the justice system in your country, or perhaps the two other ones, adopt a different approach with persons with autism?
Well, I think they go through the same criminal justice system. Some of the person with ASD might instead of go to prison, they might go to Forest Sink psychiatric unit.
Yeah, well, not yet. It's not like a clear different approach that the justice system has with persons with autism, but it's evolving. it's the knowledge about autism is increasing also. So I hope in future, in some ways.
Okay, well, ladies, thank you very much for this very interesting presentation.
Thank
I
you.
think we learned a lot. And okay,